So next on the agenda we have Lena Gouveia from Ibex Insurance.
Can you hear me?
Yes, apologies. Yes, sorry about that.
Good morning. Can you see my screen?
Yes, I believe we can.
Okay, excellent. Well, good morning to all, and thank you, Nigel, for inviting us to be part of your webinar, and welcome to everyone that's seeing this webinar as well. Before I start my presentation on national health and private health, I'd just like to introduce Ibex. We're an international insurance broker established in 2000 in Spain, Portugal, and Gibraltar. We're the largest insurance broker to the expat community in the Iberian Peninsula, and we've got 12 retail offices over in Spain and Portugal. We've got 9 retail offices in the south of Spain, and we've got 2 offices in Portugal. Besides medical insurance, we also offer, let me just go there. We also offer several types of other insurances, from car insurance, household insurance, pet insurance, so everything that you might need when you move over to Portugal. I'll start off by talking about the healthcare in Portugal. The healthcare system in Portugal consists of 3 different coexisting systems. So you can access the healthcare in Portugal through the National Health Service, which is very similar to the NHS. It's called the Serviço Nacional de Saúde, the SNS. Certain occupations also have access to the health insurance through health insurance schemes, such as the police sector, the public sector, the police, the military, and banking, which I don't think that would be part of any of the people that would be moving over, but it's always useful to know. And obviously you can access healthcare in Portugal by having a private health insurance. So how do you access the national healthcare in Portugal? You can do that by 3 means. Either use the Portuguese National Health System service as a resident, or using the European Health Insurance card for temporary stays, or by using, as Edwina said, your S1 form, which you can obtain from the UK. So how do you register for the National Health System? Firstly, you have to become a resident. If you're coming over to Portugal to work, you have to obtain what we call a social security number. You have to obtain this whether you're working for an employer or if you're self-employed. If you're coming over as a pensioner, you can get the SN1 form in the UK. And that also has to be registered on at the Social Security Office. Once you get the Social Security number, you can then register at the local health centre, which we call the Centro de Saúde. And in order to do so, you will need your residence certificate, your passport, your tax identification number, in other words, your fiscal number, and your Social Security number, or S1 form. Once you register at the local health centre, you will be given a national health number called the Cartão de Número do Utente. So with this number, you can access the national health system and also access medication at lower costs. Obviously, if you want to deal with this, we personally don't do it because we're insurance companies, but you can always contact either a lawyer or Algarve Assistance and speak to Celia, who will be speaking to you later on in this webinar. So the National Health System is funded through the general taxation and the social security contributions paid by working residents. The residents, when they registered on the national health care, they have to still pay a small contribution, so it's not totally free, towards the consultations, the hospital treatment and prescriptions. However, there are exceptions. Certain groups do not pay anything, such as pregnant ladies and vulnerable and low-earning groups. You have to be aware that dental costs are normally not covered under the National Health System, so they're normally private. The quality of care in the National Health is quite high. Obviously, unfortunately, there are still some hiccups, but that's not too bad. So I'm a true believer that although you will be part of the National Health System, it is still quite important to have some sort of private health care, access to private health care. And the reason being is because you'll have faster access to medical treatments. At times on the National Health you might wait quite a while in order to see a doctor. And if you need to be referred to a specialist, you will still need to go through your normal general practitioner in order to get a referral to a specialist. Whereas if you do it through the private healthcare, you can go directly to a specialist and seen to straight away. Obviously, on the private sector, you also have convenient appointment times, whereas through the national health, the appointment times are quite restricted. On the private healthcare, once again, you've got a choice of a medical practitioner and hospital, whereas if you go through the state system, you are appointed a family doctor, and he will then appoint the specialist that he recommends. And obviously, if you're non-resident or if you don't have any access to SNS, it's always convenient to have private medical insurance. As a broker, we work with many leading insurers, and we try and find the best one that tailors your needs. We work with international companies as well as national companies. You will notice that the international policies have got higher levels of cover. They normally are in their millions, their overall limits, whereas the Portuguese policies are normally in their thousands. Portuguese policies are basically for Portugal only. They do have a slight international medical cover for emergencies only, but they're basically for Portugal only. Whereas the international policies, you can choose from worldwide cover, including or excluding USA, or European cover. Because of these differences, obviously the Portuguese policies, the premiums on Portuguese policies, premiums are normally lower than those on the international policies. But on the international policies, obviously you've got free choice of any medical provider worldwide or in Europe. Whereas on the Portuguese policies, you're normally restricted to the medical providers that are part of the network. On the international policies, you normally, for outpatient treatment, you pay the full amount and then you request the reimbursement. The convenience of the Portuguese policies is that if you use the network, you only pay the co-payments, which is normally for a consultation, either 15 euros or 18 euros, depending on the policy you choose. You have to be aware that when you take out a Portuguese policy, you will have standard waiting periods for all treatments. Normally they range between 2 months and 3 months and are sometimes extended to a year for specific treatments. Whereas on the international policies, you don't have any waiting periods, an exception for health screenings, which is normally a year. You also have to be aware that obviously by moving to Portugal, and if you take out a Portuguese policies, the policy documentation will be in Portuguese. Some insurance companies are already starting to issue documentation in English, but most of them will only be in Portuguese, which obviously doesn't happen with the international policies, which documentation is all available in English. The other major difference between the Portuguese policy and the international policy is that there is limited cancer treatment on Portuguese policies, whereas on the international policies, cancer treatment is covered in full up to the total capital insured. One thing you also have to be aware of, which unfortunately I didn't add on my table, is that there are age restrictions in order to take out medical insurance, and that you have to be aware of. Normally the Portuguese policies, you can only take out up to the age of 64, whereas the international policies may vary between 74 and 80. There is one Portuguese insurance company which there has no age limit, which is a French-based insurance policy company which came to Portugal a few years ago. So that could be an option for the people that are thinking of retiring in Portugal. So this is just an overall summary of the covers available on the insurance companies we offer. As you can see, the international companies, AXA, a la carte, Boop and Morgan Price, normally the overall covers are quite high in their millions, whereas if you compare to the Portuguese insurance companies, they're in their thousands. So within the Portuguese insurance companies, cover can vary from 15,000 euros to 1 million, depending on the insurance company you choose from. So the MGen, the one on the top of this page, is the one that's got no limit on no age limit in order to adhere to the policy. So how do you pay for the medical expenses? So depending on the policy you choose, you can either have a reimbursement policy, which is normally what happens on the international companies. So with outpatient treatment, you pay for the full amount and then you request the reimbursement. Whereas on the Portuguese insurance companies, you're normally given a card. You go to the medical providers that are part of the network, and you only pay a co-payment at the time you receive the treatment, which for consultations may vary between 15 and 18 euros, and for medical examinations you may just pay 10% of the cost. When taking out a medical insurance, you can opt for 3 different types of underwriting. This means this is very important with regards to if you've got pre-existing medical conditions. So normally the insurance companies do a full medical underwriting, which means that when you fill in the application form, you also have to fill in a medical questionnaire. And anything pre-existing will be excluded. And this especially if you take medication or receive treatment for an ongoing condition. There are certain insurance companies which you can opt for a moratorium, which means that you don't need to fill out any medical questionnaire, but you have to be aware that any condition or symptom that you have suffered in the 5 years prior to the policy, you will need to go through a 2-year waiting period for the policy to start for those specific conditions. So for example, say if you've had a hip replacement, say 4 years ago, and you start a policy today, you will have to wait for 2 years without receiving any treatments or checkups for that condition until that problem will be covered on the policy. And the last option would be the last option would be the medical history disregarded, which is another type of underwriting, which is the most expensive one and not all companies offer. So no conditions will be excluded from this policy. However, medically history disregarded underwriting is only available on company schemes or when you transfer from a company scheme to an individual policy. It is the most expensive kind of underwriting available and normally is only available on the international policies. So this is just a small summary of how you can access the private care and the national care. If you require any further information, you can always give me a call or send me an email and I'll be pleased to send you some information.